As we promised last week, we're going to continue with the Q&A. This mom, she sends in and says it's been 3 months since she gave birth. She says she finds herself being incredibly anxious and sad most days, which she says isn't like her at all. And she's asking, could this be depression? And what steps should she take to get help?
My twin boys will be 7 months next week. I spoon feed them and they only want smooth food. When it comes to veggies, and especially when I try to add chicken, how can I get them to eat more texturized food before they eventually move onto finger food? The one is sensitive and the other is a social butterfly. My butterfly will try the textures and eat it, but he hates every moment of it. The sensitive one starts crying and refuses to eat it at all. Please help.
Since our baby arrived, I feel like my partner and I are constantly stressed and bickering, mainly due to exhaustion and just different views on how to handle the nighttime wake-ins. How can we improve our communication and teamwork during this challenging time? Welcome back to Let's Talk Baby. I'm Kath Megaw. I'm a paediatric dietitian, and it's so exciting to have Dr. Jenny Rose, my co-host and clinical psychologist, here with me today. And today, as we promised last week when we ended, we're going to continue with the Q&A. We had asked a whole bunch of you to send in some questions, and we got an amazing amount of questions and such lovely questions. And last week, we left off with talking about attachments, talking about sleep deprivation, which is really real. We looked at like whether it's good to introduce your baby to shellfish or not, and what are good carbs to introduce to our babies. So those were some great questions. If you didn't watch it or catch last week's podcast, please go back and have a look at it and listen to some of the thoughts that we gave with regards to those questions. But today we carry on with our questions, and this one, Jenny, is for you. And I think, again, a very real one. And, and you can really talk into this in your field. But this mom, she sends in and says it's been 3 months since she gave birth. So we assume her baby is 3 months old. And she says she finds herself being incredibly anxious and sad most days, which she says isn't like her at all. And she's asking, could this be depression? And what steps should she take to get help if you think it's necessary?
Wow. This is just an area that I feel so strongly about, is new mom mental health and really just supporting the transition from pregnancy into those early first couple of weeks and months. And I just think there is such a gap, and a lot of moms are not feeling contained and supported and held. There are some alarming statistics about how prevalent postpartum depression and anxiety is. And I think, many years ago, sort of 20, 30 years ago, it was really something that wasn't as common, and certainly, something that wasn't as verbalized and vocalized, that people would struggle postpartum. Mm-hmm. Now, what we are actually seeing is that it is far more the norm than it is not, that moms are really struggling to navigate this postpartum period. And there's, a reason they call this the fourth trimester rather than necessarily the first couple of months, is that it really is this transition between the pregnancy world and like the real world. And actually, one should be so gentle with this trimester. It's just as vulnerable, and there's so much that's happening. Yet, like we spoke about in our podcast last week, that there's just, pressure to sleep through the night, and are you up and at it? And how, what are you thinking about in terms of solids and this and weaning your child? And, what are you feeding them, and how often are you feeding, and night weaning? And there's just so much pressure on moms. And we really are seeing that there's a deep vulnerability in postpartum moms. And I would absolutely say that one of the biggest favors you could do for yourself as a new mom is to really try be aware and flag if you are struggling, and action many layers of support. I think if there's even an inkling that you are struggling, that you are not feeling like you used to, that you can recognize that you are maybe more anxious, that you're not as joyful or experiencing as much content or motivation in life, if there's a little bit of lack of pleasure or loss of interest in doing things that you've previously enjoyed, those are really all symptoms or signs that we should be taking this a bit more seriously. And there's so much that you can do to just offer yourself a little bit more support. And so actioning a therapy space or seeing somebody for some individual therapy is super helpful to just contain and help guide you through. We always are open to pharmacological intervention if necessary. A mom that is feeling depressed or anxious and then adding lack of sleep into the mix and high sleep can be a very dangerous thing. And we want to really take it very seriously. And if that means seeking out medication for support, that is absolutely okay. We want to normalize that too. But beyond that, there's so many other things that you can do about speaking to your partner or spouse, about receiving a little bit more support, gaining that community or that village that just normalizes how tough it is. I think we're scared to say how tough and hard the transition to motherhood is. As wonderful as it is, we don't dispute or take away any of the phenomenal part of motherhood, but we also simultaneously acknowledge that it's hard. So I would say any mom that is listening that is maybe feeling like they're struggling to find themselves or get into the groove again, don't be scared to try and action support.
So good. So go and get some support. Go and speak to someone. So good. Thanks, Jenny.
Yeah. Okay, Kath, changing gears a little bit, but here's one for you. A mom has written in and said, my twin boys will be 7 months next week. They drink 4 bottles and eat 3 meals a day. I spoon feed them and they only want smooth food. I give them pureed oats with yogurt and fruit each morning, which isn't 100% smooth, and they devour it. But when it comes to veggies, and especially when I try to add chicken, they do not eat any textures. How can I get them to eat more texturized food before they eventually move on to finger food? The one is sensitive and the other is a social butterfly. My butterfly will try the textures and eat it, but he hates every moment of it. The sensitive one starts crying and refuses to eat it at all. Please help.
Well done, Mommy, on your 2 totally different little ones there. And I know Jenny, as a mom of twins, you know exactly what that's about.
And actually, I was just thinking, I think this is also... Sorry, Kath, I'm jumping in, but what's tricky about being a twin mom is it's such a comparative thing. And, in her case, especially now, there's this, perhaps one that's more adventurous and experimental and one that's less so. And maybe if they were siblings and this was happening 3 years apart, it wouldn't feel so confronting. So it's always interesting to also think about that twin dynamic.
Yeah, absolutely. And I think that is quite something in the feed-in space, because life is busy and you kind of want to make this meal, feed them both and then kind of be done with it and move on. Yeah. Like what's going to work for both. But I think that's also a lovely intro into kind of my answer of just, I love kind of how do we define texture if we start with that? And I think smooth is a texture. So when we say our children don't like texture, that's actually impossible because if they are eating food or they are drinking, all those are textures. So I think there's this feeling out there, and it's definitely not from the kind of mom community. It comes from the professional community. And something I'm really trying to help change the terminology in is that we say you must get your babies onto texture. But from the day you start solids, they're going onto textures. Yeah. And I think what we're asking here is how do I get them onto a variety of texture? And for that little sensitive twin, you're going to find that he would probably prefer just a simple, basic texture and one type of texture. And then as finger foods come into the mix and they're ready at that age where you can start having some finger foods in front of them, that's a whole new texture. And it's less threatening because it's not going in the mouth by kind of default. You're not just spooning it in. So they can control it. They're in control of that new texture. Whereas your social butterfly, as willing as he is to give it a try and give it a go, it's still a bit offending because it used to be smooth and now it's got bitty, grainy bits in it. And especially when it comes to protein puree, like puree in chicken or beef or things like that, it definitely increases the grainy element. And some little ones just don't enjoy that. So for now, I would just keep the smooth textures really smooth and start giving them handheld foods that they can hold and experience totally different texture experience, but secondary to their smooth textures. Use that to give their nutrition at the moment and let them be introduced to different textures with their hands.
That's super helpful because it almost feels like she is asking a question that it needs to happen in like a chronological order, that we start with smooth, we then move to like a little bit more chunky, and then move to finger foods. And actually what you're saying, and maybe you can go into a bit more detail, Kat, but is not that it doesn't need to be this kind of linear, you progress towards the finger food.
Yeah, I love that actually. Thanks, Jenny, just for clarifying that. That's exactly it. That's a misconception brought about actually by the commercial industry because they wanted to make a whole lot of jarred foods. So they would do starter food, super smooth, make it a little bit more grainy, a little bit more textured, and you're still on all these like jarred foods. And then one day you like got to introduce your baby to handheld foods, but that's not how it's meant to be. It's meant to be kind of this organic flow of texture going between different textures throughout the journey of introduction to solids. And so the sensitive little one might love to stay on smooth texture for the next few months, but alongside being exposed to a mushy texture of, for example, mashed banana, and then a mushy texture of a handheld avocado that for now all he can manage is just to mush it in his hand. So it's that kind of interplay between the various textures that is quite helpful. And often the more offending textures or the new textures or the scary textures should actually be introduced more from your plate or while you eating it, so that they see it's safe, that they see it's more you eat it, I want to try it, you're safe, I trust you, I'm willing to try it. But when it comes to what I have to face, I'm going to have what I feel most comfortable with.
Yeah, sure. Amazing.
And jumping on from there and kind of also linking probably to that earlier question I asked you about the postnatal depression. There's a mom that said, and this is also very real, since our baby arrived, I feel like my partner and I are constantly stressed and bickering over the small things, mainly due to exhaustion and just different views on how to handle the nighttime wake-ins. She wants to know, how can we improve our communication and teamwork during this challenging time?
Yeah, also one that I really feel for, because I think it's again something that's so common, is really figuring out our new roles. All of a sudden we lumped into mom and dad, and that ideal that you had envisioned and imagined for yourself is often not what plays out in reality. And it's as wonderful and glorious as it is, there's really testing and challenging times. And I think the relationship really can be a component that suffers. But I think it's also just really helpful to think about, firstly, where are we missing each other? So sometimes what happens is our own frustrations, our own lack of sleep, our own uncertainty about, why do I not know what this child wants or needs in this moment? What am I doing wrong? Comes out in frustration towards your partner, because that's just actually a safe place for it to go and for one to project it. And so it comes out in irritability. And so we need to first check in, is this sort of mismatch, or where we knocking heads, is this coming from really just a place of, I'm feeling frustrated, or I'm struggling, or I'm tired, and this is just a place that I can safely project some of my difficult feelings onto? Or is there also an element of maybe not actually communicating and discussing expectations? So it's very easy to be frustrated with your partner, but have you actually sat down and said, I am feeling like it would be helpful if you also got up during the night, or perhaps after I've fed, maybe you could do the winding and resettling, or whatever it might be. But how often do we just have these expectations in our head, but we don't ever properly communicate them? And then we experience such resentment and frustration because our partner's not doing the thing we picture them to do, but we've never actually communicated it. And so I think, a lot gets lost in translation. And then maybe lastly, just to also normalize that these early months and weeks and maybe even the early years do put a lot of strain on your relationship. And doesn't mean to say that your relationship is now going to suffer, but it just means that it is a redefining of your roles and understanding how you see each other and prioritizing communication and maybe things that you could get away with before, but are a little bit trickier to get away with now. So really just coming back to the drawing board a little bit more.
I love that. And I think, like you say, managing those expectations is so helpful when it comes to that partner space. And I think that's all we've got time for tonight. But we'll definitely do more Q&As because it's really been fun. And I think we've both really enjoyed it. We said after last week's one, it was really enjoyable and definitely something that we'll include more regularly because these are also real questions that are relevant to you at the space. So I really found that helpful. And I don't know if there's anything you just want to end with, Jenny.
No, I think just to echo Kath, that, really accessible, everyday kind of stuff. I feel like this is really talking about what every parent is experiencing in their homes to some degree. And I think we just also are normalizing it. We're offering support. We're part of the village that is here to guide you. And really just reassure you that, like I often say, the fact that you're listening to this already tells us you're invested in your child and you're probably doing a much better job than what you even think you are.
I love that. Yeah. So thanks, moms. Thanks for listening in. Thanks for tuning in. If you've enjoyed this podcast, like it, share it with other moms who you think could benefit. And we look forward to seeing you again next week. Have a great week. And remember that you are good enough for your baby. And we're just excited to be on this journey with you.